All right, guys, welcome back to Underground Science. In this video, we'll be talking about the homocysteine pathway, right? Or the homocysteine metabolism in general. And we'll be talking about homocystinuria, okay? And its findings. Let's go and get started. So, the homocysteine pathway, right, of course, involves homocysteine. But what we should know is homocysteine, right, has two main fates. Okay, so if we talk about homocysteine, it has two main fates. Okay, either it can get remethylated. Okay, and all this will make sense once we talk about the pathway, right? The biochemical pathway. It can get remethylated, or it can undergo a transsulfuration reaction. A transsulfuration reaction. Okay, if it gets remethylated, homocysteine converts back to methionine. If homocysteine undergoes a transsulfuration reaction, it gets converted into a molecule called cysteine. All right. So those are the two main fates of homocysteine metabolism. Now you can imagine if there's something wrong, right, in this pathway where you can't properly remethylate homocysteine, then that means homocysteine, right, levels can elevate. If there's something wrong in this transsulfuration pathway where you can't properly convert homocysteine to cysteine, then again, that's going to lead to elevated levels of homocysteine. Okay, so um, that's just a general way in which homocysteine levels can be elevated. So let's actually talk about the pathway now. So you start with methionine, right? And then methionine can get converted into S-adenosylmethionine. All right, and S-adenosylmethionine is really good at methylating things. All right, it's a methyl donor, so it can methylate things like DNA and proteins, for example. Right, it can methylate certain molecules like DNA and proteins. All right, so S-adenosylmethionine is a methyl donor. Okay, so knowing that, right, once we get to S-adenosylmethionine, it can get converted to S-adenosylhomocysteine. Then from there, right, we get the formation of homocysteine, right? So S-adenosylhomocysteine gets converted into homocysteine. All right. Now remember, what did we say? We have two main pathways, transsulfuration or remethylation. So let's talk about the remethylation pathway. So remember, right, we get folate from our diet, right? Vitamin B9. That gets methylated and you get dihydrofolate. Then dihydrofolate can get converted to tetrahydrofolate, but it needs an enzyme to do that, which is dihydrofolate reductase. And remember, we said when we talked about this pathway previously, we said, it's not what I was trying to write. We said that methotrexate, right, inhibits this enzyme. All right. So remember, methotrexate is an antibiotic and an anti-cancer drug, and it inhibits dihydrofolate reductase. Okay, so that's a nice pharmacology tie-in. But once you get tetrahydrofolate, right? So we get dihydrofolate converted to tetrahydrofolate via dihydrofolate reductase. Then tetrahydrofolate gets converted into 5,10 methylene tetrahydrofolate. Then 5,10 methylene tetrahydrofolate, remember, gets converted into 5-methyl tetrahydrofolate. Now 5-methyl tetrahydrofolate got formed with the help of an enzyme. Okay, you need an enzyme to go from 5,10 methylene tetrahydrofolate to 5-methyl tetrahydrofolate. All right. The way you do that is with an enzyme called methylene tetrahydrofolate reductase, right? So this enzyme right here. Then from 5-methyl tetrahydrofolate, you can go ahead and methylate certain things. But we should know that 5-methyl tetrahydrofolate is the active form of vitamin B9, which is folate. Okay, so now we have an active form of vitamin B9. Why is 5-methyl tetrahydrofolate important? Because, right, it will methylate, right? It's going to give a methyl group to vitamin B12. Then vitamin B12 will take that methyl group and give it to homocysteine. All right. And then homocysteine can then get converted to methionine once it gets methylated with the help of methionine synthase who also needs vitamin B12 to function. All right. So that's the remethylation pathway. So if we go and summarize that real quick, we know we get the formation of 5-methyl tetrahydrofolate, which we said was what? The active form of vitamin B9, right? But then we said 5-methyl tetrahydrofolate gives its methyl group, right, to vitamin B12. All right. Gives its methyl group to vitamin B12. Then vitamin B12, we said, gives that methyl that it just got from the active form of vitamin B9, takes that methyl group and gives it to homocysteine, right? Then, once homocysteine gets methylated, it gets converted to methionine. So that's the remethylation pathway. But we also said it's important to keep in mind that vitamin B12 is necessary for our methionine synthase enzyme to function. Okay, so your methionine synthase enzyme needs vitamin B12 to function. All right, so that's what we said here. Okay, so we said that homocysteine gets converted to methionine after it gets methylated, right? Because of after it gets methylated from from due to the fact that vitamin B12 gives it the methyl group. Okay, so vitamin B12 gives a methyl group to homocysteine. That causes homocysteine to get converted to methionine. How does vitamin B12 get that methyl group? From active form of vitamin B9 or 5-methyl tetrahydrofolate. Okay, and we also said vitamin B12 stimulates the conversion of homocysteine to methionine because because it's a important cofactor for methionine synthase. Methionine synthase is the enzyme that converts homocysteine to methionine. Okay, so you can imagine, right? If methionine synthase doesn't work, then you can't convert homocysteine to methionine. If you're deficient in vitamin B12, you can't convert homocysteine to methionine. If the methylene tetrahydrofolate enzyme doesn't work, right, then you can't get the active form of vitamin B9. Then you can't methylate vitamin B12. And then vitamin B12 can't transfer that methyl group to homocysteine, which means you can't make methionine, so homocysteine levels build up. All right. And so those are important causes to remember for homocysteine buildup, right? What if you're deficient in folate, right? B9. Well, remember, the only way to get dihydrofolate, or remember, folate, right, gets reduced into dihydrofolate. Then this whole pathway occurs, and then you get active form of vitamin B9, okay, which is responsible for keeping homocysteine levels low by converting it to methionine. So if you don't even have folate in the first place, then you can't get to this step, this active form of vitamin B9, which means you can't reduce homocysteine levels by converting it to methionine, so homocysteine levels will build up, right? So that's important too to keep in mind as the causes for homocysteine buildup. So that's the remethylation pathway. Okay, let's talk about the transsulfuration pathway, which is another fate of homocysteine. So in the transsulfuration pathway, homocysteine gets converted into cystathionine, but it needs an enzyme to do this called cystathionine beta synthase. Cystathionine beta synthase cannot function without vitamin B6. So that means you need vitamin B6 for this enzyme to function. So again, right, you can imagine if you're deficient in vitamin B6, then this enzyme will not be able to function. So you cannot convert homocysteine to cystathionine, which means homocysteine levels will build up. All right. So maybe a dysfunctional cystathionine beta synthase, right, which we'll talk about soon, that's actually what homocystinuria is. It's a defect or deficiency in cystathionine beta synthase. So you increase your levels of homocysteine because you can no longer convert it to cystathionine. Okay, but anyway, we're at cystathionine now, right? Considering the fact that cystathionine beta synthase works and you're not deficient in B6, right? Then you get proper conversion of homocysteine to cystathionine. All right. Once you have cystathionine, you can convert that to cysteine. Okay. And you need an enzyme called cystathionase, right? And this also needs vitamin B6. Okay, so the cystathionase needs vitamin B6 to convert cystathionine into cysteine. And it's really important to remember that you need cysteine in order to form glutathione. And glutathione is a potent antioxidant, right? So, so it's important to have adequate levels of glutathione so you don't get free radical reactions occurring continuously, right? So that's the transsulfuration pathway. So you can imagine, again, like we said, if you're deficient B6 or if you have a defect in the cystathionine beta synthase enzyme, right, or deficiency, you can't form cystathionine, so homocysteine levels will build up. Okay, so that's the main steps to talk about when it comes to homocysteine metabolism. Now let's see why homocysteine buildup is bad. Okay, so the first thing we should discuss is the cardiovascular effects, all right, of homocysteine buildup. We know homocysteine is prothrombotic, right? So let's write that down. We know homocysteine is prothrombotic. Why is it prothrombotic? Because it damages your endothelial lining, okay? It damages your endothelium. And we know anything that damages your endothelium, right, can lead to the expression of tissue factor, for example, and in general, lead to coagulation, right? Clots forming. So it increases clot formation if you have endothelial damage. So if homocysteine is damaging endothelium, right? So let's say that you have homocysteine right here and it damages your endothelium, you can get clot formation. And if you get clot formation, that decreases the blood flow going to your organs, right? So if this is, which can lead to ischemia, right? That's what ischemia is. So if this clot is forming in your coronary arteries, this increases your risk of a myocardial infarction or a heart attack. If this clot is forming in the carotid artery or any blood vessels supplying your brain tissue, then this increases your risk of getting a stroke, right? So strokes, MIs, and etc., right? Anything, or atherosclerosis even, right? So that means that increased homocysteine levels increase your risk of getting heart attacks, strokes, and atherosclerosis, okay? Because if you damage endothelial lining, right, that can also increase plaque formation. Okay, so we can also draw something like this, right? It can also increase plaque formation, which again will reduce blood flow downstream. Okay, so though that's important to remember. All right. So thrombosis and cardiovascular effects, right, can be present due to increased homocysteine levels. And then we can also have other effects too that you can actually find in homocystinuria. Okay, so let's discuss that. So in homocystinuria, so what, first of all, what is homocystinuria, right? So remember, homocystinuria is just elevated levels of homocysteine in your blood and urine. Okay, so why did we get homocystinuria? Remember, we talked about a specific enzyme when we were talking about homocysteine metabolism. Okay, so remember we said that in the transsulfuration pathway, we get homocysteine, right, which converts into cystathionine, right? And we said, how does this happen? Via an enzyme called cystathionine beta synthase, right? Also abbreviated CBS. Okay, so in homocystinuria, in this condition, you have a deficiency or defect in cystathionine beta synthase. So if this enzyme is not working, then you cannot convert homocysteine to cystathionine, which means homocysteine levels build up. Okay, and just to revise, what else does cystathionine beta synthase need in order to function? Vitamin B6. Okay, so that's important to remember. So then, what will you find? What lab findings will you see in homocystinuria? Well, if your cystathionine beta synthase enzyme is not working, you cannot convert homocysteine to cystathionine. So homocysteine levels will build up. So that means if you do your blood test, right? If you look at your lab findings, you'll see elevated levels of homocysteine because you not cannot convert that into cystathionine because you don't have a functional cystathionine beta synthase enzyme. So homocysteine levels build up. Okay, so you're gonna have elevated homocysteine levels. What about if you looked at methionine, right? So it turns out that methionine levels will also be elevated. Okay, let's see why. So remember, if, right? So if we look at the two fates of homocysteine, we said was what? We said that was transsulfuration or remethylation. Homocysteine cannot be converted into cystathionine, as we've discussed, right? Because our cystathionine beta synthase enzyme is defective or deficient in homocystinuria. So then homocysteine levels build up, but this excessive buildup of homocysteine can go to the other pathway, which is remethylation. So this was transsulfuration, right? Transsulfuration. But remember, we have in homocystinuria, the problem is with this enzyme. We still have normal B12 levels, normal B9 levels, and etc., right? So this buildup of homocysteine can just get converted into methionine, right? Because this requires methionine synthase. Methionine synthase, right? And methionine synthase needs B12, okay? And then we also need in this pathway, remember, we have folate that gets reduced into dihy and convert and becomes dihydrofolate that can get converted to tetrahydrofolate via dihydrofolate reductase. Then tetrahydrofolate can get converted to 5,10 methylene tetrahydrofolate, which can then get converted into 5-methyl tetrahydrofolate, which is the active form of vitamin B9, who then methylates B12. B12 takes that methyl group and gives it to homocysteine, and then homocysteine can then get converted into methionine via methionine synthase. So if all of this that we just talked about is all of this, right, is functional, then the excessive buildup of homocysteine due to dysfunctional cystathionine beta synthase will just get shunted towards this pathway, and you'll just make a lot of methionine, right? So that's why methionine levels will also be elevated and homocysteine levels will be also elevated, all right, in homocystinuria. What about if we looked at cysteine levels? Well, remember cystathionine gets converted into cysteine via cystathionase, right? Remember, via cystathionase, who also, remember, needs B6 to function. But if we're not making cystathionine in the first place because of defect in cystathionine beta synthase or deficiency in that, then you're not going to make cysteine. Okay, so then cysteine levels will be low. All right, so we can expect cysteine levels to be low. So we have elevated methionine, elevated homocysteine, low cysteine. Okay, and then of course, if you check the urine, you're going to have elevate, or that's going to be positive for homocysteine, right? And remember, we get oxidation, right? So we have or if we test the urine, right, we'll see it's going to be positive for homocysteine, right? Because remember, we get we get the oxidation of homocysteine, which can then get converted into that. All right. So those are the main lab findings to know. Okay. So if we go back to the findings in terms of clinical features, right? What we see in the disease, right? Which so we already talked about all this, right? The fact that we're deficient in cystathionine beta synthase. Okay, remember that means that what does cystathionine beta synthase do? Converts homocysteine to cystathionine, which you need vitamin B6 for. And remember, you combine serine too with it. So if you can't do that, you get elevated homocysteine, and that's what you see in homocystinuria. Okay, so what findings will we see? So we're going to see Marfanoid-like features, okay? Features similar to Marfan syndrome. So what are those features? Okay, so first we're going to see Marfanoid habitus. Now, what's Marfanoid habitus? Right? That's when you have long limbs, right? Scoliosis, tall, right? Tall stature, things like that. So that's Marfanoid-like features. So tall stature, long limbs, right? And then scoliosis, right? So you can see things like that in homocystinuria. You can also see intellectual disability, okay? And we already talked about the fact that homocysteine damages your endothelium, which increases thrombus formation, right? So again, that's due to endothelial damage caused by homocysteine. This can lead to things like atherosclerotic buildup, myocardial infarction, stroke, and so on, right? Then you see lens symptoms too, okay? You can see lens subluxation, all right? So lens subluxation in homocystinuria would be downward and inward, okay? Downward and inward. And the reason for this is because you have weak zonules, right? So that's where you get a downward and inward displacement of your lens. Remember, right? We have, um, so I'm not good at drawing, but let's try, right? Remember, you have your eye like this, okay? And then remember, we have our iris. Okay, so actually, let's draw it like this. So we're gonna draw our focus on the lens, right? Just to explain what the zonules are. So we have our eye like this, and then we have our, geez. So let's say this is our cornea, right? And then we know that we have our iris, right? And then we have that opening, which is our pupil. And then you have your ciliaris here, right? And then we have our zonules, okay? So your zonules, so where's your lens at, right? Your lens is behind your iris and behind your pupils. So if we draw a lens like this, you have zonules, right, that attach to it. So if you have weak zonules in homocystinuria, then you get lens issues, right? Because remember, your zonules are important for lens accommodation, okay? So, for example, when your sympathetic nervous system gets activated, right, you can contract your zonules to flatten your lens so you can see far, okay? But if your parasympathetic nervous system is activated, you can contract your zonules and then you can see close, right? Because your lens gets more globular like that, which helps you see close. So if your zonules are weak in homocystinuria, it's important to remember that you get downward and inward lens subluxation, okay? Downward and inward displacement of your lens. All right. So that's the ocular manifestations in homocystinuria. And then we can also remember the fact that you see cardiovascular disease, right? Because again, that's related to thrombus formation. We talked about scoliosis. You can also see things like kyphosis, okay? And we said intellectual disability, but an important thing to remember is increased risk of fractures and increased risk of osteoporosis. Now, why would that happen? Well, it turns out, right, that increased homocysteine levels, right, can do three things that can affect your bone health. So, increased homocysteine can affect collagen cross-linking, okay? And if you can't cross-link your collagen properly, then you can't make strong bones properly, right? Which means you're going to have brittle and weak bones, which can increase your risk of fractures and osteoporosis. Increased homocysteine levels also, right, it can affect your osteoblast function, okay? And we know osteoblasts secrete osteoid, right? And then if you combine osteoid with mineralization, like phosphate and calcium, right? You can like then you can get hydroxyapatite formation. And then this can, if you combine osteoid with mineralization, as we know, that forms bone, right? But if increased homocysteine levels decrease the function of your osteoblasts, you're going to have a hard time forming strong bones. Okay, so that's another cause of why increased homocysteine levels can lead to osteoporosis and increased risk of fractures. Now remember, in this disease, in homocystinuria, your cystathionine beta synthase levels don't work. So that's why we see increased homocysteine levels. But if your cystathionine beta synthase enzyme doesn't work, you don't get formation of cysteine. Remember, we said you need cysteine in order to form glutathione, okay? But if you don't form cysteine in this disease, then you don't form enough glutathione, which means you have increased, right, free radicals and increased oxidative damage. One of those places can be to your bones, which means that can, of course, increase your risk of osteoporosis and fractures. Okay, so that's why you see that finding in homocystinuria. And that's basically it, right? So that's homocysteine metabolism and homocystinuria. Now, before we end this video, I want to discuss a very important lab findings, right? Uh, between our talk when we're talking about differentiating between conditions, okay, like B12 deficiency, B9 deficiency, and so on. And only two things we'll focus on when we're talking about these lab findings are going to be homocysteine levels and um, methionine levels. Okay, so let's write it right here. Homocysteine levels and methionine levels, and we'll shrink this like this so we can make a nice table and talk about different conditions and why we see what we see with the homocysteine methionine levels. All right, so we're going to say conditions in this table. And honestly, the main differentiation I want to make is between B12 deficiency and B9 deficiency. So if we're talking about B12 deficiency, all right, we can think about this, right? Because remember, you needed vitamin B12. Okay, so let's talk about this here. You needed vitamin B12 to take the methyl group from activated folate and give it to homocysteine. So I'm just going to say methyl group here, right? So that homocysteine can get converted into methionine, right? We know that now, right? Because we talked about this. So if you're deficient in B12, not only can't you methylate homocysteine anymore, but remember who needs B12? Methionine synthase. So now, if you're deficient in B12, you can't methylate homocysteine, so that means you can't convert homocysteine to methionine, and methionine synthase can't work properly now. So now you even more can't convert homocysteine to methionine, so that's going to lead to a buildup of homocysteine. So homocysteine levels will of course be elevated in B12 deficiency, okay? But remember, we just said both of these things is stopping the formation of methionine. Okay, you can't form methionine because you need methionine synthase to do that, and you don't have B12, so methionine synthase can't work. And you need homocysteine to be methylated in order to even form methionine, but that can't happen because you don't have enough B12 to transfer that methyl group that B12 got from who? 5-methyl tetrahydrofolate, which is activated B9. B12 needs to give that methyl group from activated folate to homocysteine. But you don't have B12 because we're talking about B12 deficiency, so you can't do this. So homocysteine can't get methylated and cannot get converted into methionine. So you see decreased methionine and B12 deficiency. Okay, but if we compare that to B9 deficiency or folate deficiency, right? If you're deficient in folate, okay, remember why do we need folate? Well, you need folate. Remember that gets converted to DHF, DHF to THF, THF to 5,10-methylene tetrahydrofolate, and then that gets converted to 5-methyl tetrahydrofolate, which is the active form of vitamin B9. So you need folate to get 5-methyl tetrahydrofolate, and you need 5-methyl tetrahydrofolate to give the methyl to B12, so the B12 can give that methyl group to homocysteine, so that homocysteine can get converted into methionine. So then if you're deficient in folate, you don't have proper levels of activated folate, which means you cannot properly give enough methyl groups, or you can't properly methylate, I should say, B12, which means B12 can't transfer methyl groups, or its methyl group to homocysteine, which means homocysteine cannot get converted to methionine. Okay, so if if you can't if you can't convert homocysteine to methionine because of a folate deficiency, homocysteine levels are elevated. Okay, so let's stay consistent with our colors. Okay, homocysteine levels are elevated. And then if you can't convert homocysteine to methionine, methionine levels are decreased. So we get similar findings between homocysteine methionine and B9 and B12 deficiency. Okay, well, what about methylene tetrahydrofolate reductase deficiency? What will we find here? So remember, where do we see methylene tetrahydrofolate reductase come into play? So when homocysteine gets converted into methionine, we said this process needs an enzyme called methionine synthase. And said methionine synthase needs B12 to function. Okay. And then we said we get folate, right? That gets converted to DHF, gets reduced, right? Then DHF to THF via dihydrofolate reductase. Then THF to 5,10, 5,10 methylene tetrahydrofolate. Then we said 5,10 methylene tetrahydrofolate gets converted into 5-methyl tetrahydrofolate, which we said is activated vitamin B9. And 5-methyl tetrahydrofolate gives its methyl group, right? So let's draw it right here like this, gives its methyl group to B12. B12 gives that methyl group to homocysteine, and then homocysteine gets converted to methionine, okay, via methionine synthase, who also needs B12 to function. So we have that pathway clear, right? Methylene tetrahydrofolate reductase, right, is involved in this step right here, where you get the formation of 5-methyl tetrahydrofolate. So let's write that in, right? So methylene tetrahydrofolate reductase is needed for this reaction to happen to go from 5,10 methylene tetrahydrofolate to 5-methyl tetrahydrofolate. So if you imagine, if you're deficient, right, in methylene tetrahydrofolate reductase, so you can't, that means you won't be able to do this reaction right here, right? Convert 5,10 methylene tetrahydrofolate to 5-methyl tetrahydrofolate, which means you cannot methylate B12, which means B12 can't give that methyl group to homocysteine, which means homocysteine cannot get converted to methionine. Okay, so again, in methylene tetrahydrofolate reductase, you're going to see, right? If you can't convert homocysteine to methionine, homocysteine levels will be elevated, methionine levels will be decreased. So we can go and write that down. Okay, so homocysteine levels will be elevated and methionine levels will be decreased. All right. And then let's talk about cystathionine beta synthase deficiency. All right. So we won't include that in the table because we ran out of room. So let's just talk about this here, right? In free space. So remember again, right? Homocysteine in the transsulfuration pathway converts to cystathionine, right? Via the enzyme cystathionine beta synthase, who needs vitamin B6, right? To function. If you're deficient in cystathionine beta synthase, then what happens? You can't convert homocysteine to cystathionine. So then that leads to an elevation of homocysteine. But then that means that all this excessive elevation of homocysteine can just get remethylated and get converted into methionine, right? Via the enzyme methionine synthase, right? Via the help of B12. So you're actually going to see elevated levels of methionine and elevated levels of homocysteine in cystathionine beta synthase deficiency. Okay, so that's it, right? Those are the conditions that I just want to differentiate when talking about methionine and homocysteine levels in the blood. Okay, so That's it for this video. I hope this video made sense. I hope it wasn't too confusing. Thank you guys for watching and see you guys in my future videos.